Start the procedure by obtaining the patient's oxygen saturation and pulse rate using a pulse oximeter. This will serve as your baseline reading prior to starting nitrous oxide. Your assistant should record this information for documentation purposes. Once done, turn the control panel on by pressing the power button and set the total flow to 6 liters per minute using the up arrow with a plus sign. Fill the mixed gas reservoir by pressing and holding the O2 flush button until the reservoir is visibly inflated. Once done, carefully place the hose and nasal hood assembly over the patient's head and gently seat the nasal hood over the patient's nose. You may want to involve the patient in this process to ensure maximum comfort. If necessary, lean the patient's chair back to allow for more flexibility of motion. Use the hose slide behind the headrest to lengthen or shorten the amount of hose available. At this point, you may begin to slowly increase the flow of nitrous oxide. Start with 15%. Ask the patient how they're feeling, and if it's safe to do so, increase the flow of nitrous oxide another 10%. Ask the patient again how they're feeling. If the patient's still not experiencing the therapeutic effects, and it's safe to do so, increase the flow of nitrous oxide by another 5 to 10%, always making sure to check in on the patient to see how they're doing. Ensure that any changes in nitrous oxide flow, along with oxygen saturation and pulse rate readings, are documented in your record. These readings should be recorded about every 10 minutes to ensure an accurate medical legal record. Your assistant will play a critical role in keeping an accurate record and ensuring patient safety. Your assistant can also help you keep an eye on the mixed gas reservoir. When properly inflated, you can see it expanding and contracting as the patient breathes in and out. This helps you to know that the patient is receiving the proper mixture of gas. Once you have ensured that the situation is stable and the patient is comfortable, you can begin providing treatment as needed. At the completion of treatment, slowly decrease the level of nitrous oxide in the same manner as you increased, doing so by 5 to 10% at a time. Be sure to check with the patient to see how they're responding to these changes in nitrous oxide level. Carefully continue to decrease the flow of nitrous oxide until the percentage reaches 0. At this point, you can sit the patient up and begin administering 100% oxygen for 5 full minutes, which will help to ensure that the patient clears the nitrous oxide from their lungs. After the 5 minutes are up, turn the unit off and have your assistant record the final reading. After removing the hoses, ask the patient how they're feeling. If the patient should feel dizzy or nauseous, have the patient sit back and consult with your attending about possibly re-administering 100% oxygen. If the patient is not feeling any side effects, instruct them to carefully and slowly rise from a sitting position.